Hey, everybody, welcome to Dental Voice Season 2. My name is Rolando Mia, and this is Zyrus. We have a guest, a returning guest that we spoke to, think about this, 4 months ago. So when the purpose of Dental Voice is to hear directly from clinicians, to understand perspective, what's going on, and also get advice. We talked to Cecilia Spellman, who is an RDH, about 4 months ago, and she shared with us some opinions, some perspectives about what's going on. And now that we're back, now that she's back working, we're revisiting that to see how she's doing, and also hear what's real, what's not, and what additional advice she would give. So, Cecilia, thank you for joining us, and you look fantastic.
Thank you for having me. I'm so glad I had time to finally get in this and do this with you guys.
Oh no, and we appreciate you doing that. So, first of all, this is the end of your day. You've just finished working. I noticed you've got sunburn on your nose over there. And so
Wait,
how is it? How is it going? Take us
I wish
through.
I could say that's a sunburn. This is proof that the N95 hurts. Yeah, no, it's the days are much longer. They're much quicker. They're definitely much quicker. A lot more suffocating. It's a lot hotter in Santa Barbara right now, but we're doing good. We're managing, and there's a lot of changes, and thankfully it's going well.
So it's going well, which is good. But so when we first talked, you had been out of working for a while. You were really excited to get back. You were eager to get reconnected with your patients and all. But because of an underlying, you mentioned to us that you had an underlying lung
Disorder.
or
Mhm.
this yeah,
Mhm.
and a little bit of fear. How is that going? And are you experiencing anything, or are you okay?
Thank you for asking. Yes, I have a lung disorder. It's called alpha 1 antitrypsin's disease. It is a genetic disorder. Um, Coming back into work, you name it, I was freaking out. I was panicking. Dr. Dukes so we got the green light to come back early May. We chose not to come back right away. We waited for the ADA handbook to come out, which has been altered many times, but we waited to have that to properly get the office and the room set up and the supplies, of course, which I'm sure at some point we'll talk about. And that initial week coming back, I came back before the rest of the staff, and it was very nerve wracking. I was extremely nervous. There is no telling, even though I am a young, active person, it doesn't make me bulletproof, is pretty much it. And so that first, probably, I'd say 3-4 weeks in total, it was nail biting, and you're just constantly trying to recycle through all the things you were told and what to do and what's next and each step, and did I do this, and oh, did I wipe that down, is this sprayed, it's a lot. You do have to find an order. It's no different than jumping into dental hygiene school where you're like, what in the world am I doing? And you're fumbling with everything. I kind of did the same thing. I'm sure not the only person, but I have a rhythm now. And I'm going through the process every day, and every procedure, that might be different. And I am very healthy still, thank goodness, knock on wood. I'll be honest, I have taken a COVID test too this week. It was negative, and I'm grateful for that. And it's something, I'm doing everything that's being recommended on my free time, getting my fresh air. I'm working out. I'm out in the sun. I'm doing my vitamins. I'm eating healthy and following the protocols as much as I possibly can. And definitely, I feel good. Now I feel good. Not as nervous anymore.
So what was
Yes.
what was it? First of all, I want to understand your experience with all of the PPE, because I'm checking out that nice little sunburn you have on your nose, and it's the end of your
Yeah.
day. And your hat. What's
Yeah.
your experience with that? How is that? How is that? How is that going?
It's so hot. It's like really, really hot, to be honest. So like the N95 masks, I'm sure many people initially had a lot of issues finding the N95 masks. Dental people were not at the number one of the list to be able to access these things, which is wrong. I'll say it, especially considering that registered dental hygienists for the longest time were at the number one top of the list. Well, now respiratory therapists are with us. And the N95s needed to be accessible for us. It's not fair that throughout a lot of these last couple months, I've noticed that we are not considered like people don't really, they're just now kind of recognizing how we should be essential, I guess, in simplest words. So that, and we should have been able to access these N95s, and we were getting KN95s pretty easily. The price gouging like crazy. People are certainly doing it left and right. It's absurd. So we've got the N95s now, though, and we do still have KN95s. I am wearing a level 3 surgical over that, so there is no breathing all day.
So on top of your N95?
Yes, on top of the N95, and that's a moisture control situation. So, you know, for limited purposes, the CDA president did back first week of May, did a kind of like a course and run through of what the ADA is recommending. And you can wear an N95 mask 3 times a week, 7 days in between each time you wear it for 8 hours, and it has to go into a brown paper bag. And so we're doing that. And in order to keep it from getting moist on the outside, you put a level 3 surgical over it. I am also wearing a face shield. Of course, I've got the surgical cap, you know. Kudos, my best friend made them all for the office because we couldn't have any, we could not find any anywhere. It was crazy. We have surgical gowns that we're changing in between every patient. We were lucky. I got those ordered as soon as I came in, but they were still back ordered. Lots of things back ordered. So the surgical gowns, we just got our final shipment of them about 2 weeks ago, maybe not even. But they were coming in kind of splotches, and we were doing a lot of laundry. And so we've been pumping those through. The disposal ones, you know, limited access on those, price gouging on those, environmentally not friendly either, to have to change out as much as they're recommending. So thankfully we're good on jackets now. We're definitely scrubs and shoes are staying at the office. We do not leave our practice with the clothing that we're wearing and the shoes that we're wearing. Yeah, which is really nice because then I'm doing half the laundry. Yeah.
You know, for everything that you've been through, you just are happy. Is it because of me and us, or are you just, or is it because you're back at work and you get to you know, how are your patients? What's it like working with your patients? Are they kind of freaking out, or are they feeling good?
I'd say about like 25% of people, well, maybe about 25% are still not coming back. They're booking out several months from now. They're coming back. They're just not quite ready. But you know, I don't know if you guys remember from our last interview, I talked about my patient who's 100 years old and she was turning 100 in July. I got to see her. She's 100. She came in here spicy as ever, you know, and she is well, and she promised me she was going to see 100. So I got to see her about 3 weeks ago, and she's doing well. Most of the patients are very, very grateful, no matter what. What's interesting about coming back as a hygienist, you know, we get a lot of, I feel like patients have a lot of, they feel comfortable after they've seen you for so many years to kind of voice what they want, how they feel, etc. And it's interesting how many people don't have zero hesitation to express like their negative thought process about everything COVID, and how they don't care, or they don't, or the hoax to it, or whatever that's floating through their mind. And it's interesting because I have facts, and I have no shame to spit those facts out to stop that mentality and negativity in my room. And that's kind of the few people that I've had to deal with it. They understand as soon as I open up about like, listen, I'm in your mouth, like, and I'm exposing myself to this, and I am a frontline worker, and we should be essential, and for your safety and everyone else's safety and my grandparents and your grandparents, this is what you need to do. And I'd say like everyone's had a pretty decent response. A lot of people are definitely glad to come back, and they're glad to be here, and many people overdue. We had over 300 dental hygiene patients that were canceled on. due to this. So backflow, like that list is just barely moving. It's kind of like creeping. We still have a very long way to go, but we're getting through it, and people are very understanding, thankfully. But otherwise, everyone seems to be in a pretty good mindset. We're really lucky. Santa Barbara has a lot of, like, there's always been kind of a pretty darn positive attitude for the most part. So I'm happy and I'm grateful to be here, and going through the weeks. They're a lot longer, they're a lot more tough, but I'm here.
So I love the fact that when people are coming in, they're doing that. You said you have a lot of facts. What facts do you share with your patients about what's going on, and how does that tie to reassuring them?
Well, I mean, it amazes me how many people don't even consider or recognize the fact that we are like the number one most likely to contract. Who would have thought? I'm in your mouth, you're breathing in my face, and they're just kind of, oh my gosh, how's that? I would have never have known. And then they go, oh, well, I guess so. And so, stuff like that I'm talking to them about. And the people who have hesitancy, I'm explaining to them about, to like the protocols that have been out there for us to gather and be able to implement in our office, letting them know that these are the measures that we are told to do, that we are doing. We're very lucky that to things like in Santa Barbara, dental practices, there has not been many. I do know of a couple practices that have had a couple of positive cases, but we've been really low on our cases, not in general in our normal world, but in our dental fields too. Those are things to pay attention to and to be recognized, so that you do come to your appointments and you do remember that your mouth is entirely connected to your entire body, your bloodstream, your brain, your heart. We know these facts. So it's not to be ignored, but also to know that you need to come in and we all need to be safe.
Awesome. Mm-hmm. When you look at the 4 months ago, mm-hmm. and then now you compare to today, what are some of the top or key learnings that you've run into that you're like, here's what I thought, here's what's really happening, or here's what I thought is not happening at all? What are some of those based on your experience and what you're going through right now?
I'll be honest. One of the things that was really discussed, and it has been discussed many times, is the limited use of the procedures that you do. Cavitron, perfect example.
Ultrasonic, right?
Yeah. Do you really think I can do all of my job without that? I wouldn't be able to open a jar at the end of the day if that was the case. Like, it's not realistic. I'm going to say it. So, like, I am fortunate enough to have a doctor. I preached this before. We put our brains together when I came in to discuss how we can change the practice and get it into a safe environment. I am very lucky to have, doors that open right out the fresh air of the ocean. He created and fabricated evac systems for every room that have an arm that actually can move straight to the patient's face to pull any aerosols out. Those are all things that help to get you through the day. And so at the end of the day, if I have that patient who's got 5mm pockets and they're just loaded with calculus and they were due, March 16th and they're on a 3-month recall, I'm going to use that Cavitron because their mouth matters to me. And I have seen in a very short time of coming back to work, quite a lot of infections. And I don't know if it's stress induced. I don't know if it's because they're overdue for their appointments or what it is, but at the end of the day, I am covered. I'm doing my part. I'm thoroughly disinfecting my room. I have airflow. I have evac. If that deep pocket and that tooth is at jeopardy of being lost and having a periodontal abscess or whatever it might be, I'm going to clean it with a Cavitron. So that's kind of the one thing that was very interesting going back when I was not working, is you get all the mindset of not doing this and not doing that. And even the health department said not to polish the teeth, but to use a manual toothbrush. You want me to take a manual toothbrush to somebody's teeth? Right? Like, no, I'm not doing it. So I am polishing teeth. I am using my evac.
All right, you've frozen on me. You've frozen on a really, really good picture. Did your phone fall down? Oh.
No.
There you go.
Oh, sorry.
You're back.
I don't know.
Oh no.
I didn't know.
I love live things because this stuff happens.
Yeah.
No, thank you for that, and thank you for the for it's great to hear that that's happening, and that yeah, it's not quite the same. Now we're hearing a lot of dialogue about dental teams, hygienists, dentists. What are you hearing, and what can you share with us with regard to kind of the dynamics going on? You have such a it clearly a fantastic relationship with your doctor. You're also a very strong person, so
Mm.
I suspect that that helps. That helps.
Yeah.
I'll tell your husband that. That helps that you have the courage and the strength. But not everyone is like that. So what are you hearing out there?
It's interesting. When we first came back, wow, because it wasn't just me. A lot of people kind of came back all within the same couple weeks, and so I feel like I helped a lot of people try to gain a voice.
Hmm.
And I'm such a strong believer in constructive conversations. Yes, it's one thing to have a strong opinion. It's one thing to be, I am a little intense. I get it. But it's one thing to have those things. But like my doctor respects my opinion, and so other people who maybe don't necessarily have that were reaching out to me like crazy. All kinds of offices, pediatric offices, orthodontic practices. Uh, Regular general dentistry, lots of hygienist assistants, front desk. I was hearing from a lot of people who were freaking out because they weren't getting any of the help that they would expect from their office team during a pandemic. They were not getting the assistance with having face shields and the proper masks, and putting the shields at the front desk, the clear shields, and or not having surgical gowns and still being limited. And so I did have quite a few people initially really come at me left and right with it. It was nonstop for probably the first 3 weeks we were open. But also too, there are several practices in town that a lot of like there's an office in town that the entire staff walked out because they refused to do the recommended options of keeping the office safe. And I know of many people too who were maybe a little more seasoned hygienists who just chose not to come back. Several people who have little ones that need to be in Zoom classes for school, that they needed to stay home with them, so they decided they're done temporarily. It's been quite a mix. So Santa Barbara is definitely low with the amount of hygienists we have in town right now.
What feedback or what advice would you give people who are struggling right now with that, or just walking out? I mean, that must be huge for an entire team, or even an individual to make the
Yeah.
decision. No, I'm not going back. I just feel that badly that there's no way I'm going to go back. So what advice would you give people?
Well, you know what? I've said it before. If you are not happy, what are you doing? You spend more time in your office than you do typically at home with your family. And there will be a second home for them somewhere else, and to be patient. And we all need to be patient during all of this and know that it is going to pass. It will, and that it will get easier. And that if moving on from your scenario or finding a different place is okay. It's okay. It sucks. It does. I'll say it, it does. Nothing about it is easy. I know we've had this discussion before about jobs and positions and everything else. I moved across the country and came out here and didn't know a single person. And I had to start from scratch. And it took me 2 years, 3 years to finally get like a placement that I felt happy with full time. And now I've been at this practice for almost January will be 7 years. So you have to be patient. You have to be willing to fight for it and not willing to settle, and still being kind and recognizing that these are very weird times for everyone. Everyone is going through something, and that it will be okay. And know that your safety matters. And if you are not feeling safe and you're not comfortable, there is a place out there that will make you feel comfortable.
That is, and it is consistent with what you said before. Be honest, be direct,
Mm-hmm.
be courageous about it, and if not, ask for help. And it sounds like that's what people are doing.
Yeah. I mean, what's worst that's going to happen? They say no, and you go, okay, time to move on. Like,
Now,
okay. It doesn't hurt. That's the worst part. That's the worst thing that could happen.
I could see being your dentist and you going, oh, time to move on.
Yeah.
Like, wait, that didn't go the way I planned it. What's up with that?
Speaking, prep yourself maybe, but keep it floating in the back of your head that, okay, I should probably put my feelers out there a little bit.
So of those who are there are so many new things, so many new protocols. You mentioned them. I started keeping a mental track and I lost count at like 14. How is that? I mean, are you experiencing any kind of backlash because people are being asked or required, or now in addition to your whole function, there's dozens of additional things that you have to do, or is it just become part of what you're doing?
It definitely has become part of what we're doing, but every single person in this office has a role, and that's where it starts. Is in a situation like this, you cannot leave one person dependent on everything. It's like the front desk. We have a front desk, we have an office manager and a private office. Each one of them have their own roles. And if one person is out, another person needs to be able to gather those roles. And we have a system and a flow. Flow is so important in a dental office. And I know I speak on behalf of everyone. Without a flow, it's just chaos and everyone's just grumpy. And that we're not capable of doing that. That having that flow and established right from the beginning, we had a protocol day before we came back. So protocol day where everyone came in, we established the rules, we established the flow. I had talked about too, patients sitting out in their vehicles and waiting to be called on. Instead of doing that for us, what worked better, we have stairs to get up to, and an elevator and everything like that. And it's just, there's a timely factor too. And if you don't have the flow and everything kind of preset, it does get really behind. So we've set out outdoor seating. So we have benches set up, and we also have another dentist right next to us. We have a doctor's office, we have an accountant's office, and an insurance office. So for that, we've got several areas of open outdoor space, but we're limiting how many people come in to the practice at a time who sit in the waiting room. You're not allowed to have a certain amount in there depending on your size. And having we are sending a wellness screening out that was created by the American Dental Association. We're sending that out 24 hours in advance for them to fill out. If they do not fill it out, we get notified, and they have to do it as soon as they come into the practice. We are declining patients who have traveled. That is something. It's one thing for me and my husband to go camping at Lake Kachuma or whatever it is and be just the two of us and then come back. It's another when you're hopping into a big bird in the sky and taking a trip to Florida. It's a whole other ballgame. So that system has really worked for us in implementing a stage and giving everyone responsibilities. Yeah.
That's cool. And you systematized it so that now it's not this is unknown. There's a structure, and that sounds really cool. Now, I've spoken with other clinicians out there, and we've run into this, and I know you use the Isolite, and we appreciate that. Some hygienists out there are struggling or don't want to use it because it doesn't work for them. What comments or what feedback would you give those folks about that? And because the ones, it eliminates aerosols, all that type of stuff. What advice or what would you tell those folks?
User error maybe, and I don't mean that in an offensive way. Because if it doesn't work for you or you're not liking it, there could be a potential reason for that. So I've used it for sealants, for laser therapy, for scaling and root planning, especially laser therapy, because laser therapy in the burnt tissue, really gathers that. It's great.
So you've used Isolite for all of those?
I've used them for all of them, yeah. I'm very lucky because I've been here for so long. I really don't see a lot of new patients who have a lot of comprehensive issues. Like I have some patients, I definitely have my handful of more comprehensive periodontally and comprehensive patients. But I find that I don't really have to do as many aerosol induced procedures because I see so many repeat patients. Whereas, there's been a high fluctuation of new patients coming in who haven't been to the dentist in 10 plus years who need those procedures, and the Isolite system is of course, it makes it easier on the patient. It makes it easier on you. And if a hygienist or clinician in general, whether it be a dentist, a hygienist, anyone, if they're having an issue with it, I think that they need to maybe have a one-on-one with somebody who has experience with it and be sat down to try to show them like maneuvers and eat. Because when I first used it, I was like, this is too big. How is this going to work? And no, you need a certain way to put things in and maneuver things and encouraging it for their safety too, to be able to use it. And I know, my doctor, he's been using it forever. And actually just on Friday, he had a procedure done on himself and used it. I came in on Monday and he went, wow, man, yeah, that worked great. So, and he's never had it on himself. He's just used it on everyone else. So, also too, for a clinician who may not like it, maybe should really try to do it, have it used on them and see how it feels. And, and try to do what you can to keep yourself safe right now. And if trying to relearn how to use it to maybe encourage that, why not?
Oh, appreciate that. And yeah, because you've been using it, I really appreciate that. That helps a lot. Reach out and go work with someone who knows. Now, your practice is, it's wonderful that it sounds like you all are busy. Yes?
Mm-hmm. Yeah.
I'm hearing that there's some practices out there that haven't even opened yet. Are you experiencing, or are you getting patients, or are you seeing patients who have been trying to get to other practices that just haven't opened and they're coming to you? Are you seeing that?
Well, there is an office in there. We've had a couple people where there's just a lack of hygiene because hygienists have left and they're not coming back. So we've had a fluctuation of that where they don't want the dentist to do their cleaning or their prophy or their periodontal maintenance or whatever it is. I don't blame them. I'll say it. I don't blame them. But so we've had like weird, I would say that wasn't their intentions to leave. So I have seen that a couple times. I think a lot of our high volume of patients that are coming in are because people have a little more of a flexible schedule. They're working from home. They're not as strict about their hours maybe, or they can maybe take an extended lunch in the middle of the day. I mean, everyone always wants the first appointment and the last appointment. That's like the number one, or lunch. Those are the number one appointments. Where now I have, people who are like, yeah, I'll take 10 o'clock. That's no problem. I'm like, thank you. Where were you 3 years ago when I couldn't fill this?
Oh, that's awesome. No, it's great to hear that things are. I mean, you clearly are having to overcome the changes, and you're having to overcome, and adapt to the extra things that you're dealing with. But what I'm feeling is that it's doable, right?
Yes, it is doable. And I think that if you just take the time to do your research and to listen to people and reach out to one another and recognize your importance as a hygienist. Our career is very valuable and it is essential. And if you have the abilities to be out there and doing it right now, and you can feel comfortable enough, it's, do it. And it's okay to be a little intimidated and worried and paranoid or scared or all the above. Because I know I've gone through every cycle of it. Literally every emotion. I told you guys I have had it. Okay. But if you just process it and take a step back and try to get yourself into it, I think that people really will realize how much we are appreciated now. I feel like I'm appreciated now more in my career than I have been ever, and I've been in dentistry for 12 years. So this is a prime for me. It'll definitely be a time to remember.
That is awesome. So the message out to other hygienists out there. You're a member of the Santa Barbara Dental Hygiene Association. You're very active in supporting that. You talk with a lot of them, a lot of the other hygienists and other clinicians, assistants, all that. What's the kind of the message you'd like to get out to them as we close this out?
Yeah, well, I get it, for everyone out there, the assistants, the hygienists, the front desk, because everyone's I think we're all just kind of being pushed that little further than we were before. And it's this career field was already, it can be very stressful. and just know they're not alone, and know that this is temporary. And I've said it before, but continue to be patient and to communicate with one another. Do not let those bad, negative mentalities just sit in your system. Talk through it and breathe it out. Go take a walk, get fresh air, pull your mask off, rip it into pieces when you can, let it out. I know I do. Like, I got the red nose to prove it. So at the end of the day, I'm just like, ugh. And just know that they're not alone, and everything that they're going through, because it's not just in our work field. I've told you guys I don't have children, so people are dealing with a lot more right now than just being a clinician, being a clinician and being in people's mouths. They're going through much more than that, and it's a lot of people, and we get it. We all get it. We're here for one another. We're gonna get through this, and it's going to be a great outcome, and know that you're appreciated and that your time is valued.
Awesome. Thank you for that. Thank you for spending the time. Thank you for sharing your insight, your experience, your energy, your smile, your everything. It's just very, it's inspiring. It's great. Yeah. And thank you for that. So here's the deal. If people want to get in touch with you, again, what's the best way to do that? Or if they want to ask you questions?
Feel free to contact me at mesadentalsb@gmail.com. I am on the Santa Barbara Dental Hygienist Association Facebook page. It is a direct link to my email too, so you can contact me through that. And I'm here for you. Let me know. Or if you want just to talk to somebody, I'm great at that.
I love it. I love it. Thank you so much.
My husband all the conversations, so he doesn't have to have them. I can have the conversations with other people.
That's right. You have a runway model husband, so we won't get into that.
Yeah. He'll start blushing when he finally watches this.
Well, in several months, again, if we wanted, or if I wanted to talk to you again, would you be willing to join us again and share your ongoing journey and experience and how this is all going? Would you be open to doing that again?
Yeah, yes, bring it on. I'm hoping at some point we'll be able to have a conversation about, vaccines out. Life is trying to go back to normal, and that I went and had dinner with my husband, since I haven't done that in like 6 months or something. So, hopefully things change and we can continue. I'll be here. Awesome.
Well, hey, those of you who join us, thank you so much. I love the energy that Cecilia has and her insight. There's a pragmatism to it, but there's also a directness about it. And the message I get when I listen to her is that, hey, your function is important. There is help. Ask for it. This is not something you need to do by yourself. And yeah, we're going to get through that. There's a lot of stuff you got to change, but that's part of everything. So Thank you for that. And I really appreciate that. Those of you, if you like this content, please share it. If you have any questions for us, or you want to get to Cecilia, please reach out, send us your questions, send us what you liked, what you don't like. And most of all, be safe. We look forward to seeing you again. And thank you so much. Have a great evening, Cecilia. You are absolutely wonderful. You are awesome.
Thank you. Stay safe. I appreciate it.
Take care.
Bye.